Thanks everyone for joining the call. Uh, I just want to introduce myself. My name is Yajna Brata Sahu. I'm the Aligned Account Manager for IIT KGP Foundation India Group Medical and Policy. As some of the alumni are yet to join and some of the alumni have already joined. So I would request Dr. Sandeepa to start the session. Meanwhile, if anyone wants to be part of the call, they can join. If anyone is having any kind of concern, any kind of query related to the session, they can ask in during the session or in the Q&A session. Dr. Sandeepa, over to you.
Hello, good evening, everyone. I'm Dr. Sandeepa Krishna. Currently working at Dr. Reddy's as a primary consultant care physician. So basically covering all areas of consulting patients and the employees of the given organization. So currently I'm with 5 years plus of experience in the same. So let's go ahead with the presentation, and I hope that it will be worthwhile for everyone here. And just not to keep it monotonous, meaning I'm the one talking alone, let's keep it proactive. Please give in your opinions and thoughts whenever proved upon. So the topic for today's presentation is heart health. And these will be the takeaways. What is heart health? Significance of maintaining a good heart health, factors contributing to a good heart health, lifestyle, etc. I'll be going in depth about it. So basic anatomy, that is a must know for everyone regarding heart and associated diseases, so that you can understand if you ever have been going through a cardiovascular problem. WHO recommendations for good heart health, prevention of heart diseases, and preventive health checkups and blood tests that you have to do on annual basis, and immediate action to be taken if you are suspecting someone is having a heart-related issue. Okay, going forward, if anyone has anything to ask me, or if any questions about my presentation, you can either unmute yourself or you can wait for the session to be completed, where I'll be having 15 minutes of Q&A where you can ask whatever that's needed. Okay. So firstly, what is heart health? So anyone would like to venture an opinion here? What is considered as heart health?
I think without medication, no medical heart history, no medications.
Yes, that's right. So firstly, National Association of Chronic Disease Directors refers to cardiovascular health as health of both heart and blood vessels. Okay, it's not our heart alone, it's the blood vessels that supply blood to the entire body. So both have to be in a healthy condition, like one of you've told, disease-free without using any medications to help us, thrive the conditions. So that is what cardiovascular health means. So what are the significances of maintaining good heart health? Why not just pop in medications and just keep it running? Anyone?
Doctor, any medication is going to be a load on the heart anyway.
Yes.
So to avoid the load, you should have no medical and no medication and no medical history.
Yes.
Heart related.
Yes. Apart from that, what is the significance of maintaining good heart health? Meaning, why should you make an effort to, like you've told, not get your heart to that condition where it requires medications?
Just repeat the question, ma'am.
What is the significance of good heart health? Meaning, why should you put in an effort to maintain the health of your heart?
So that it services all the cells in the body, giving oxygen and collecting waste, or what do you call, carbon dioxide, or what do you call it?
Okay, that's one of the reasons. So firstly, like you've told, brain is the seat of intelligence, and the seat of health, the seat of good health is your heart. Okay, so you can still live as a vegetable if you have some kind of brain stroke. But if your heart has some kind of problem, that's the end. Okay, so these are the reasons why you have to maintain your heart, in the healthy index. So because it lowers your risk of high blood pressure and stroke, it can support a physical activity. Only a healthy heart can support a physical activity. Once you have conditions where you're using medications for your heart to be in a normal, to continue its normal function, so it no longer can support normal physical activity. So to enhance cognitive function, like one of your colleagues have told, all the cells in the body depend on the blood supply provided by a healthy heart, including your brain cells. So to have a proper cognitive function, you need proper healthy heart. And lowering the risk of dementia, that is vice versa. Dementia means it's a condition where you have started to become forgetful. Okay, this happens when your brain cells are dying. So one of the reasons your brain cells are going to be healthy, it's because you have a healthy heart. So these are the reasons why you need to strive to keep your cardiac health at optimal level. Okay, so factors contributing to good heart health. Anyone? What can you do to maintain a good heart health?
Doctor, it could be many reasons: sleeping,
Yes. Yes.
exercise, sleeping, and ensuring you don't take cholesterol, heavy food and
Yes.
preservative related foods, and you got to take care of so many things. I mean, it's not just one or two. You can there's a
Yes.
full list of that.
Yes, it's a spectrum of factors. So firstly, avoid alcohol, right? Smoking, of course. Smoking is a known health hazard, not only to your heart, but every cell of your being, okay? Be it liver, be it brain, be it lungs, whatever it is, smoking and alcohol consumption are a known health hazards. Next, you have proper sleep timings, like you've mentioned. And if you are a person diagnosed with some kind of heart issue, so maintaining compliance with medications is a must. Okay, it's very important you maintain the compliance with medications and follow-ups with your cardiologist to keep your lifespan at the maximum with the given condition. And of course, proper diet. Low in cholesterol, high in fiber, vitamins, and multinutrients. Okay, these are the basic things that you have to take care, not just for your heart health, but for your overall physical health. Okay, so these are definitely something that you have to avoid. Next, so going further, basic anatomy of the heart. I have included this because this is a must know for everyone. Heart diseases are very prominent in our country and throughout the globe. So if you are encountering personally in your life, or if you have someone who in your family who has a history of heart disease, you should know what and why. I mean, you should know what is to be done, what is the immediate steps, etc. Okay, what's happening. So this is the basic anatomy of your heart. You have 4 chambers, right? 1, 2, 3, and 4. Okay, these 4 chambers are the ones that pump the blood throughout the body. You have a major vein, you have a major artery, okay, and the valves between the chambers. So all the major types of heart diseases that are encountered on day-to-day life, the more common types of heart diseases, like heart attack or a stroke, or someone requiring a valve replacement. Okay, someone's heart has a difficulty in pumping blood. So everything is associated with the same anatomical structures. So this is the reason it's a must know. Next, healthy heart versus unhealthy heart. So how do you know if your heart is healthy or unhealthy? I think this was already, yeah, please.
Is it something to do with the very medical tests that you do, pathological tests that you do regularly,
Yes,
whether it is stress test, 2D
yes,
echo, cholesterol, lipid
yes,
profile? It could be.
yeah. All of these will help you further evaluate the condition of your heart. Yes, you're right. the blood test, the basic annual blood test, which is more or less included in everyone's profile these days, is something that will help you determine. And like you've mentioned, the lipid profile and the stress echo test, they will mention the deposit of plaques within your heart, within the arteries that supply heart. Like you can see in this picture, if your arteries that supply the heart have some kinds of deposit, so that means that it's not healthy. Okay, there is a high risk that you can end up having a heart attack, maybe in the far future or near future, depends on your lifestyle. Okay, so this is how you know if your heart is healthy or not. And of course, your blood test will further help you to pinpoint what are the steps to be taken to prevent any kind of disastrous situation. I'll go further about these blood tests later on. Okay. So diseases associated with neglected heart health. So the first most important sign of neglected heart health. Now, neglected heart health comes with poor lifestyle choices, unable to quit smoking, drinking, recreational drug use, etc. Okay, so the first most common sign that comes up with neglected heart health is atherosclerosis. Okay, so atherosclerosis is basically deposit of fatty plaques. Like you can see in this picture, these yellowish deposits are basically nothing but unhealthy fats which are traveling in your blood since many years, at least 20 to 40 years, and over time they tend to deposit and create blocks within your blood vessels, within your major blood vessels. Okay, so what happens when usually this condition, it usually comes out or shows itself before it is too serious in your lipid profile. Okay, but even if you have had a recent lipid profile and your values were not proper, they were quite high, and you've decided to neglect it, so what happens next? The next thing that happens is your blood pressure raises. Okay, because your major arteries already have deposits that is creating a barrier for the blood to pass on effectively or pump effectively. Your blood pressure increases. And even then, without consulting a doctor, you decide to follow your own Google treatment, or your own self-treatment, which many people are doing nowadays. So what happens if you ignore your high blood pressure issues? That's when you end up having a heart attack. Okay, one day your blood pressure is high enough and the blocks are severe enough that the blood supply to the heart is cut off, and that's when you start having a heart attack. And once you have a heart attack or an event of heart attack, you are current medical guidelines, we put the patients on permanently, on some medications, including a blood pressure management medication, blood thinners, so that you won't have a second event or you won't have stroke or a brain stroke down the line. So there are some sets of medications that you are permanently put on. But some people tend to ignore even that. So what happens when you ignore even after having a first cardiac event? You can end up having a stroke. You can end up having valvular diseases. You can end up, that could be the last cardiac event as well. So this is what happens when you neglect heart health. It is very much important that minimal signs and symptoms are taken seriously and major lifestyle modifications are made as soon as possible. Right? Okay. So WHO recommendations for good heart health. This is about the same. Okay, balanced diet. You have to include 20 to 40% of protein depending on your body composition. Another 20% fiber and another 40 to 45% carbs. Okay, this is your balanced diet. This is how your plate should be every meal. So this is one of the major lifestyle modifications, which is very much difficult to make given this time and day, since we are more habituated to the unhealthier version of food intake. So balanced diet is very much important. Next, quitting tobacco and alcohol. Like I've already discussed, it's very much important that you let go of these habits. quality hours of 6 to 8 hours, quality sleep for 6 to 8 hours a day. So what do I mean by quality sleep? Anyone?
No disturbed sleep.
Yes, exactly. So it doesn't matter if you are sleeping at night. It doesn't matter if you're sleeping in the daytime. Okay. I know that many of us, we have night shifts. Many of us, we have rotational shifts. Okay. So as long as your body is habituated to a particular rhythm, your sleep should be undisturbed for 6 to 8 hours. And that's what a quality sleep means. And that is very much required for your body to detoxify. Okay, and detoxification is very much important for heart health as well. So when it comes to workouts and exercises, minimum of 150 minutes of cardio and resistance training each per week is recommended by WHO. Okay, it's not enough if you just run. It's not enough if you just walk. If you are in a good physical fit, if you are still in a young age, and if your physical fitness is still good without any disease burden, it's very much recommended that resistance training is also included in your workout routine. So 150 minutes, okay, per week. Next, maintenance of heart health in people with heart diseases. So can you guess what's the most important thing that these people should do? I've already discussed it.
I think it's medication and walking for older people.
Yes. Yes.
Because
Medication.
because collaterals come in, then you can start developing
Yes.
collaterals.
Yes, that's right. That's very much right. Compliance with medications. Okay, I'm pretty sure we all have this one member in our family who will just not listen. Okay, they will just take medications at their own pace. They will not follow the doctor's advice. They will take medications as and when it pleases for them, or they will just stop taking it altogether. Okay, so much of miscommunication, so much of poor information available on the internet, which is much more easier to believe than a doctor's advice. Okay, because it's much more easier for us to mentally take in that medications are not important. But this is the truth. As far as scientific and medical advancement goes, as on this day, it's very much important to keep in compliance with your medications. Okay, no matter if you've had a procedure to keep your heart running properly, be it an angiogram or a bypass surgery, or even if it is a minor cardiac event, if you are recommended to take certain medications, it's very much important you keep compliance with it. Okay, instead of following a non-medical practitioner who gives you advice on certain social media platforms, if you have a query about the number of medications, or if you are concerned about the type of medications that you have been prescribed, you can very much go for a second opinion with a better cardiologist, or a third opinion. But yes, as of now, medications are the mainstay of cardiac treatments. Okay. Next, low intensity cardiac exercises. Okay, so people who have had a cardiac event, be it a minor cardiac attack, or be it minor stroke, or anything, a slight raise in blood pressure, because of which you may have been admitted in the hospital for one night stay in the ICU. So in these people, high intensity exercises are not recommended. Low intensity cardio and low intensity strength training exercises amounting to 150 minutes every week each. Okay, so 150 of cardio and another 150 of strength training per week is very much required to keep your muscle activity going. Okay, that will help you preventing your body to get further diseases, because the most common disease that couples with poor heart health is diabetes and obesity and high cholesterol levels. Okay, these three are very much common, something that all of us know. So if you want to keep your heart health in control,
Madam, repeat
yes,
that. What are the three things you said?
diabetes, obesity, and high cholesterol levels.
Thank you.
Yeah. So these three diseases are something that are very common, which accompanies your poor heart health. So if you want to keep them at bay, if you haven't yet got them, or if you have already been using medications for them, still you have to inculcate low intensity workouts within your daily schedule. It's very much important. Next, Be compliant with your physician and cardiologist. Okay, very much important. Like I've told you, instead of going with people, non-medical people or non-medically trained people and their advices, it's very much important that you follow the advices by a proper medical practitioner, be it a physician or a cardiologist. Go for second, third, fourth opinion if you're not satisfied with the outcome, if you're not satisfied with with the way things are going. Okay, but you have to keep compliant. Next, prevention of heart diseases. So I'd like to ask every one of you, heart diseases are very much a genetic thing among Indian population. Everyone knows that. So is there a way you can prevent heart diseases?
First of all, as we discussed earlier, if you do a regular regular checkup, number one, you do physical activities like you said, 150 minutes or whatever, and
Yes.
keep your eyes open for any changes or any pains or any heart related issues.
Yes, prevention of heart diseases is still possible if those are inculcated from a very younger age, at least from mid 30s to 40s, okay, when people are still healthy. So American Heart Association recommends the following screening tests for coronary artery diseases starting at age 20, and blood glucose screening should begin at age 45. Okay, now I understand that no 20-year-old could just walk into a clinic and get angiogram done or whatever the heart test he or she thinks is right for him or her. But apart from the blood tests, like you've mentioned, lifestyle modifications can be inculcated from a younger age. Okay, given the comparison between this generation and the previous century people, our health has deteriorated very much, okay, given the sedentary lifestyle, increasing rates of obesity and cholesterol diseases. So it is very much important to inculcate proper lifestyle modifications from a very early age. And if the person is at a high risk of heart diseases, some heart diseases are of course congenital, you have them from birth. So of course your lab test, screening test, etc., they will begin at an early age. But if you are an average middle-aged healthy individual without any physical health burden, then I recommend to most of my patients that it should start at the age of 35. Okay, we are seeing increasing cholesterol off the chart values since age 25 as of now. So proper monitoring of all health parameters should start at least from age of 35. And like this cutout says, blood glucose screening should start at 45 as well. And in my opinion, for Indians, it should start at 35 as well. Okay, just to keep in check. So these are the basic lab tests that should be done. So a lipid profile, which is more commonly known, it will calculate all the cholesterol levels with the sample, blood pressure and blood glucose. This is something that you have to get done on an annual basis from the age of 35.
Doctor,
And
what is blood glucose?
Blood glucose is basically the amount of sugar that's present at any given time. Okay, this is mostly a diabetic test. Okay,
No,
people.
that I understood that.
Yeah.
What I meant was, what are the tests you're talking about? Are you talking of fasting, PBS, and
In general,
HB1AC, or what are you
yeah.
talking about?
In general, people who are not diabetic, it's better to get HbA1c. That will be more than enough. People who are diabetic, usually we recommend them to get HbA1c fasting and post lunch. So when I say blood glucose, it is in general in reference to the age and health parameters. So if you are diabetic, it's a different set of blood tests for measuring blood glucose. And if you're non-diabetic, HbA1c will suffice.
Madam, one small comment
Yes.
I'd like to make here. The doctors, the diabetes related doctors keep changing the goalpost every time. In the sense, earlier it was 6.5, then it went to 7.5. Then they brought it down to 5.8. What is the correct? I know you're a cardiologist and related to the heart, but
No,
glucose,
it's fine.
that doctors keep changing the goalpost every year, because to increase their medical intake or buying of the purchasing by the various population, to increase their balance sheet basically at the end
Hmm.
of the day of the companies. So why
Yes.
do they keep shifting the goalposts every time?
Okay.
Because it confuses
Yes, it confuses
non-medical.
people, right? Yeah. Hello, are you still there? I think you got cut off.
I'm here.
Yeah, yeah. So, as far as I know, since the last 10 years, the standard mean HbA1c is considered to be diabetic if it's above 6.5. Don't let anyone else tell you otherwise. I know that there are doctors out there who are putting people on diabetic medications, even if they are at the pre-diabetic stage, which means 5.5 to 6.5 is pre-diabetic stage. Okay, and I know that some doctors will ask you to start off with the basic medications, and I have seen many such patients, and most of them are surprisingly young individuals, ages 35 to 45. But concerning the range, 5.5 to 6.5 is pre-diabetic, and above 6.5 is diabetic already. And in pre-diabetes, the current international guidelines recommend lifestyle changes only for the first 3 months. And after 3 months, again, you have to get another HbA1c done, coupled with fasting and postprandial. And if significant improvement is seen, these lifestyle changes will be continued. Now, this is also, we usually combine it clinically with the patient's current health profile. If the patient's current health profile is a young individual, male or female, with no other disease burden, so this is the current guideline. But if they already have some of the other disease burden, meaning they already have been diagnosed with hypertension, or they already had a cardiac event, and right now they are pre-diabetes, a very small dosage of basic diabetic medication is started off, just as a preventive measure. Because at that point of time, when your body already has a disease burden, it is very much difficult to treat diabetes with lifestyle modifications alone. So these are the usual guidelines. Most of the doctors, or at least some of the doctors, they fail to explain it to the patients, why you are being put on certain medications. And even on the patient side, it's difficult for them to understand to start using a diabetic medication, especially for young individuals. But as far as related to your question, above 6.5 is diabetic, 5.5 to 6.5 is pre-diabetic. So the goalpost is the same, but the treatment depends on the holistic approach to the patient's needs.
Thank you, madam.
Yeah. So like I've told you, these are the three blood tests that's required, the basic blood tests for a young individual. So cholesterol, blood pressure, and blood glucose. Next, for those people who are above 45 years of age, and those who have been diagnosed with hypertension or any cardiac event, regardless of their age, should have these tests done accordingly. So ECG, Doppler ultrasound, and stress echo is something that is done on an annual basis, and 6 monthly basis if required for that particular patient. But angiography and coronary CT is done only if the circumstances have the indications. Okay, if there is an ongoing cardiac activity, or if there is an ongoing stroke, that is when these two are usually prescribed, or if there is a suspected cardiac stroke. So these two are usually prescribed. So ECG, Doppler ultrasound, and stress echogram, echocardiogram are the ones that are usually done for those above 45, okay, along with cholesterol and blood pressure and blood glucose tests. Okay, so let's talk about the Indian scenario. So I've already talked about Indian scenario, how we know of a person in every family who's very much negligent, right? So statistically, at present, India has the highest burden of acute coronary syndrome. Okay, ST elevation myocardial infarction, which transcribes to heart attack. Okay. Another significant problem in India, among other cardiovascular diseases, is hypertensive heart disease. Okay, because people diagnosed with hypertension, usually they just don't take their medications. They just believe that they don't need the medication, or they want to try a few days without the medications. They want to experiment using another medication that the pharmacist prescribe. Okay, so which is why hypertensive heart disease is very much high, causing 138% increase in comparison with 1990. Okay, this increase is not just because of negligence alone, it's also because of increasing sedentary lifestyles prevailing our current career prospects. So this is the current Indian scenario. And in addition, just to give you an additional information, 3/4 of patients with coronary artery diseases are not on guideline recommended basic therapeutic drugs. So this is what I was trying to explain earlier, that I know and I am aware that some physicians can go ahead and without the proper indications, just start you on medications, of course, just to increase their own pharmaceutical sales or whatever. So yeah, people are not on guideline recommended basic therapeutic drugs, which is the reason it is very much important that you are aware of what the current guidelines are. Okay, it's not necessary for you to know which drugs you're supposed to be using. That is not possible. You need to go through a total course of medicine to know which drugs you're supposed to be in. But to know the current guidelines, to be familiarized so that you are not on unnecessary drugs or over-medicated or under-medicated for whatever current condition your body has. Okay, it is very much important. And this is the major reason for higher morbidity and mortality. Usually these scenarios are seen in places where doctor to patient population is quite high. I mean, the ratio is quite high. So whatever the doctor says, the patient will just blindly follow, and be it over medication, under medication, or not following the proper guidelines, no one is very much aware about it. So yes. Next, immediate action to be taken for a suspected heart disease. So I would like to ask who here has already gotten some kind of training in basic life support? So
Are you talking of CPR or something?
yes, basic life support. It's a training given by American Heart Association. You are certified trainer once you finish the course. Who here has got that course? Anyone?
Very few people are even aware of the existence of these CPRs.
Yeah.
So where is the question of getting certified? I know CPR, but I didn't even know there was a course which certifies you as a professional to be able to take action at the right time for people who are undergoing. So this is something new I'm learning today.
Yes. So there is this particular course called Basic Life Support, otherwise known as BLS. So it is something that anyone above a 10th grader can take the course. You do not have to be a medical professional for that. Anyone above 15 years of age who has had the basic minimum qualification of 10th grade can take up this course. It's just a one-day course, and it is very much beneficial because there are many people who have signs and symptoms of heart attack, and they just collapse right there and then and there, and without proper medical help, without proper access to medical facilities, it can be a legal, I mean, it can be a fatal problem. Okay, that is why the morbidity rate or the mortality rate of cardiac diseases is very much high in India. So I'll talk about that course more a bit later. So firstly, if you are suspecting a particular person to have a heart disease, okay, just check if the person is conscious. Okay, can anyone tell me what are the usual symptoms before a heart attack?
There are so many actually: perspiration, pain in the left side,
Yes.
left arm. It could be drowsiness. You
Yes.
just really collapse. There
Yes.
can be so many. I mean, but you
Yes.
need a vigilant eye to be able to understand that.
Yes. So a cardiac event, be it a person having a heart attack, or if the person is having a brain stroke, to a non-medical eye, the symptoms will be pretty much the same. Okay, but whatever the scenario is, we do not need an immediate diagnosis right now. What we need is immediate action. Okay, so if a person is complaining either of the following symptoms: difficulty breathing, so the rate of breathing is quite high. The person, he or she, complains that he is unable to get enough breaths. Okay, pain radiating to the left neck or the left arm. Okay, of course, this is a classic symptom, but not everyone who is going through a cardiac event will have that symptom. Okay, patient complaining of a squeezing pain in the chest area. Now, this again is a conflicting symptom, a symptom that many people ignore and take it for gastritis, but it is something that should never be ignored, especially if the patient is complaining of a squeezing pain. Difficulty talking, okay, excessive sweating, sluggish words. Okay, now difficulty talking and excessive, talking sluggish words can also be symptoms of a brain stroke. So like I've told you, we are not here to diagnose if it is a brain stroke or if it is a cardiac arrest or if it is a gastritis problem. Okay, if the person is having any of these symptoms and if the person is still conscious, okay, forgot to show the pictures, right? So you immediately call for help. Okay, do not do anything on your own until and unless you're a medical professional or you have some kind of training in the medical field. Okay, if the person is conscious, just call for help immediately. Go to a nearby healthcare facility or call for an ambulance. Okay, because there is always a window period when it comes to cardiac events and brain strokes, and that window period should be utilized very much carefully. Just for further information, that window period is 90-minute window. Okay, it's just 90 minutes. So call for help immediately. Now, if the patient is unconscious, now what does unconscious mean? Two scenarios again. He is unconscious but breathing, unconscious but not breathing at all. Okay, in this scenario, if you are a person who is who has no kind of training, like for example, I've mentioned the BLS training or whatever, you call for an ambulance as soon as possible. Do not call for everyone else, gather around, make a fuss about it, but just call the ambulance. That should be your first step. Or if you are a person who has BLS training, you can perform a quality CPR until the person or until medical personnel arrive. Okay, I know that in India, ambulance contain nothing more than just a driver who is basically a non-medical person. But a basic ambulance facility should contain a paramedic who knows how to give a quality CPR along with the ambulance driver. Okay, so if you know how to perform a CPR, please go ahead and do it only if you have a proper BLS training. If you do not know how to perform a CPR, call for help immediately, and the medical help will come and perform the same. Because performing CPR is not just simply pressing onto the person's chest. Okay, if you're doing it wrong, you can end up having you can end up giving a person a broken rib. Okay, which is far more dangerous than a cardiac attack. Okay, so make sure that you know what to do, and if you do not know what to do, you do not do it. Okay, this is very much important. So I'd like to end this presentation with the quote, "Get to the heart of the matter and care about heart health," because it is very much pivotal that information is power. And if you know proper information about the guidelines, if you know proper information about what's going on with your body when a doctor says you that this is going wrong, and you know how to verify it, you are already at the top of your own health. So if you have any questions, please go ahead.
One question, doctor.
Yes.
I had to start out on the statins and thinners and the blood pressure medication. Now, I also do a 6-monthly evaluation of my lipid and the complete profile. And it always keeps dropping. Cholesterol is improving. Thinner, of course, you can't make out.
Of course.
The blood pressure is but the doctors are reluctant to take off the frequency of the medication per day.
Okay.
Now, I on my own cannot do it then, because we are not we are always worried, should something happen, what will happen? But
Yes.
why are the doctors reluctant to reduce instead of a daily, it could be 5 times in a week, it
Hmm.
could be 4 times. If my cholesterols are very good, they
Hmm.
improved, you can see it because
Hmm.
I've changed my lifestyle, I've changed in my diet, I'm not touching fried stuff, the cholesterols have improved, the blood pressure has come down because you do yoga, you
Hmm.
do meditation, and all
Hmm.
all your parameters are coming down. Then
Hmm.
why are they reluctant to not bring it down?
Okay, so actually, it's a very important question. Most of the medications, not just cholesterol medications, your hypertension, diabetes medications, right now, whatever range of medications we have, all these medications act only on a 12 to 24 hours basis. Okay, so if you are a person who's already started these medications and your cholesterol is currently controlled, your hypertension is currently controlled, it is because you are taking these medications on daily basis. So if you start taking these medications on alternate day basis, or let's say 5 days a week, the medication will simply not work, because the mechanism of action of these medications is taking enough medication so that the level of required therapeutic dose, we call it a therapeutic dose in medical terms, okay? This is the amount of medicine that is supposed to be present within your blood at each and every point of the day, okay? And only at that level will the desired effects be achieved. In your case, lowering blood pressure and lowering your cholesterol levels. If you start taking the medication in alternate days, or if you start taking the medication few days a week, that is just simply how the medication doesn't work. In order to maintain the therapeutic doses, currently all the medications are prepared in such a way that requires a oral intake once a day, once or twice a day, depending on your condition. So that is why once you have achieved the required results, we just want to keep it that way. We don't want to reduce it, because that would be counterproductive.
Let's do it the other way around. Why not? Okay, you don't want to reduce from 7 days to 5 days. Of course, the doctor has already done it with my persuasion. He
Hmm.
brought it to 5 and 4 days. No
Hmm.
problems up to now. But I am putting it the other way around. Instead of trying to do that, why not reduce the potency?
The dosage.
No, the
Hmm.
dosage I maintain as you are saying. It
Hmm.
has to be there in the bloodstream.
Hmm. Hmm.
I'm saying the potency of the drug. For example, it's 120 mg. Let us
Hmm.
bring it down to 80 mg. For
Hmm.
example, I'm taking CT 40, which is
Hmm.
6.2 or 12.5. That
Yes.
I can bring it down to 6.25.
Yes. Yes. I
And
understand.
I still take it every day. It's there in my stream, but it's a lower potency. And obviously, these are all synthetic medicine. All your
Hmm.
medicines are synthetic. They
Yes.
all have their side effects, like beta blockers, the alpha blockers, and
Yes. Of
other things
course.
are all there. They are actually harming our body, and we'll realize it only after 5 or 10 years only.
Hmm.
So I'm trying to reduce my synthetic intake by
Hmm.
reducing the potency. That's what I'm trying to tell the doctor. But the
Hmm.
doctor is reluctant because the higher potency ones are more expensive. That's again the
Yes.
same
Yes.
bottom line, the profitability of the company, and I
Hmm.
don't agree with what the
Hmm.
doctor says.
I understand what you're trying to tell me, but if you remove the factor that the doctor is trying to, increase the sales of his pharmaceuticals, which is why the potency is not being reduced, I'd like to point out a fact that, yes, like you've told, synthetic medications, Western medications have their pros and cons. But given their pros and cons, the pros that it does to our body, see, for example, you have taken the drug, let's say you have started taking the drug today, and you start experiencing the side effects like you've told 5 to 10 years from today. But in a holistic scenario, the side effects or the burden of those side effects is much lower compared to the burden that you would have if you wouldn't be taking those drugs in the first place. That's point number one. Second, of course, you can try to reduce the dosage. If you are using 12.5 BP medication, the doses that you have told, hydrochlorothiazide, it can obviously be reduced to 6.25. But this is again something that has to be monitored. If your doctor is being reluctant to reduce the dosage, you can go for a second opinion, And you can obviously try to reduce the dosage of your BP medication or cholesterol statin medications. But once your body has been exposed to one particular dosage, it is very much difficult for the body to readjust to a smaller dosage. Your BP might start to fluctuate. You might start to have those side effects that you have mentioned. And thirdly, it doesn't matter if you're taking a 12.5 or a 6.5. The side effects that you are supposed to experience 10 to 15 years from now will be there. Even if it is a 6.5 on daily basis, even if it is a 12.5 on daily basis. The side effects will be there if your body has the trait for it. Not everyone experiences side effects, by the way. I'd like to point that out. Only 10 to 15% of population experience the side effects of all these drugs that we are talking about. And every day new drugs are being put up in the market where the side effects are comparatively low. But yes, it doesn't matter. For example, the basic diabetic medication metformin. It doesn't matter if you take 250 or 500 or 1000. You take the dosage by which your blood glucose is maintained at a proper controlled state, but the side effects will obviously occur no matter what dosage you're taking. That is the medications of today.
Okay. Ma'am, I'll just take 1 minute of the time of everybody. It's just, I just want to add to what you've been saying. The side effects are not only for allopathy. Today, there are side effects even for Ayurvedic.
Yes.
There are no, let me finish, doctor.
Yes.
Just 1 minute. I'm just sharing something for everybody's digestion. Even in homeopathy, there are side effects. Why? The reason is these doctors want to become rich quickly. So Ayurvedic, which is a natural herbal extract which you're taking, they are adding heavy metals like mercury and others, which fires your kidneys and liver. Come to homeopathy. People are adding cortisone to get jetpat effect, to get an, homeopathy is a very slow moving, it gives you results. So when you add cortisone, it speeds up the thing. So that also, today it's difficult to trust anybody, whether it's allopathy, whether it's homeopathy, whether it's Ayurvedic. It's just, it's a chance that you get a good and conservative doctor. Just my thoughts that I'm sharing with you.
Yeah, that's true.
Madam, I have a question.
Yes.
And that is, there seems to be different thoughts or suggestions about medications for this thing, cholesterol.
Yes.
So some people say that cholesterol is a natural thing. Even the body produces cholesterol. So there's no need for going into medications. And others say, well, cholesterol is something that gets deposited. It will narrow the blood vessels. And so obviously you need to get into medication. What would you suggest about cholesterols?
Okay. I come from an allopathic background. So yes, I completely agree that a particular level of cholesterol should be handled by medications. Okay. I wouldn't speak for the other alternative medical fields, but where I come from, cholesterol levels beyond a particular level obviously has to be treated, because this is based on evidence. There is evidence. So, for example, you've definitely known of someone who's had a heart attack or a brain stroke within your friends or family circle, right? Why is it that every person who's had a cardiac event or a brain stroke, when you do an angiogram, there are blocked arteries? Most of them, they are either going for a stent replacement, or they are, if the the block is quite heavy, you go for a bypass surgery. Okay, because there is evidence that unhealthy fat deposits can lead to so and so disease burden. But I get what you're trying to tell. When I say that there is healthy cholesterol, yes, there is two types of cholesterol. You have healthy cholesterol and you have unhealthy cholesterol. When you look at the lipid profile, just don't go with the total cholesterol. What most people do, or I might like to add, most physicians nowadays, what they are doing is they will just look at the total cholesterol value and put the patient on medication. Okay, the usual value is below 200 is normal. Okay, that is the lab value. But the clinical sense here is, if you look a bit below into the report, you have different types of cholesterol listings there. You have HDL, which is your good cholesterol. You have LDL, VLDL, which is the actual culprit. Now, are you putting the patient on medication based on which cholesterol? Just the total cholesterol or based on the division? This is something that I would like the patients themselves to be aware of it, because no one will tell you this. Total cholesterol is high, so it doesn't automatically mean that you have a cholesterol producing disease, or you have a disease where you have high cholesterol. Sometimes people have cholesterol values of 250, 300, but they are very healthy as a horse, if I might say, because their HDL is a bit high and their VLDL and LDLs are still within control. So these parameters are very much important when you consider putting a patient on medication. These are the actual guidelines that should be followed. So this is the confusion that's going on there. And yes, reducing cholesterol unnecessary will obviously cause damage to the body, because your brain has the most amount of cholesterol. It's the fattiest organ. But you have to look at all the parameters before starting a medication on your body. That is how it works.
Thank you.
Yes. Anyone else?
Hello. Can
Yes.
you hear me?
Yes, I can.
I am taking a medication for BP, telmisartan and 40, and 75 years old. I
Okay.
get sometimes 110 by 60 BP. So I want to know the lower diastolic, how low can it go?
Not lower than 60.
Should not go lower than 60.
Yes, not lower than 60. But given your age, you can sometimes, if you are measuring your blood pressure at home on a regular basis, sometimes you will notice 50, etc. I'm pretty sure you must have seen some of the other times, but that is still fine. But usually your BP should not go lower than 90 by 60.
90 by 60.
Yes.
Okay. Okay, thank you.
So, doctor, one question, doctor. Just help me to understand what is the purpose of this 2D echo. Basically, it gives you the efficiency of your heart, right, doctor?
Yes, 2D echo is basically an ultrasonic picture of your heart.
Efficiency of your heart, right?
Yes, it will, you can see in live how your heart is functioning, if the pumping action is fine, if the valvular functions are fine, and if the heart muscle itself has any kind of disease burden.
So what happened was the other day, mine came to about 60, or my wife's came to 72, came to 60. So I went back to the cardiologist and I told him, doctor, should I do a 2D immediately? He said, no, nothing to worry. Normal range even between 50 and 55, the heart is good at your age of 73.
Okay, you mean the EF, right?
I'm saying at around 73 age, to between 50 to 55%, you have the efficiency factor that comes up.
Yes.
So he said that also is good. So is that correct?
Yes, it's correct.
50 to 55 is okay.
Yes, it's correct, because at that age,
73.
At 73, without any disease burden itself, if a completely healthy individual gets a 2D echo done, normal range for them itself is 50 to 55. So if the person is taking any medications, etc., also 50 to 55 is considered pretty much normal, because your heart will wear out with the age.
Okay, thank you, doctor.
Yes, yes. Anyone else? We still have 2 to 3 minutes.
There's one more question I want to ask. See, I'm taking this medication, but I heard that at my age of 75, 130 by 90 or 140 by 90 is actually okay. But then why should I take medication that is coming down to 110 by 60 or 115 by 65, like that?
Yes. Why you have to take medication is, can I ask, when were you placed on a blood pressure medication?
Quite some years ago.
Like
many years.
5 years ago, 10 years ago?
Actually, I am taking for more than 20 years.
For more than 20 years.
Yes.
Okay. Back then, what was your blood pressure which indicated your physician to put you on a medication?
That I think went up to more than 140 at a younger age.
Yeah. So at a younger age, if your blood pressure is more than 140 without any medication, that is almost an indicator for you to start on BP medications. But
Yeah.
it means that if you are at an older age, given 75, 73, right? So at
75.
the age of 75, without medication, there is a chance that your blood pressure will exceed 150, 180. So that
Yeah.
is the reason you're still taking the medication. Okay, yes, of course, you are completely right. At your age, 130, 140 is still pretty much fine, because with age, along with your heart, even your blood vessels will wear out. Okay, the blood pressure, the resistance will increase on its own naturally. But we have to keep it right there. Since you have had an issue of blood pressures at the earlier age, at a younger age, so there is a high probability that right now, given the situation that you weren't on a medication for a week or 10 days, your blood pressure may or will definitely reach above 160, 170, which is quite dangerous at your age. So that's the reason you're still being asked to use the medication.
Yeah, but then I can reduce the medication, not so that it's
You
not.
can try. You can definitely try. You can discuss it with your physician when you're reducing medication, be it whatever the disease it is, but blood pressure, diabetes, whatever. And this is for everyone. If you're trying to reduce the medication, because of course you know your body much better than the physicians, you can definitely have a discussion with your physician. And if they are open-minded as well, proper monitoring is definitely required. Okay, your body, in your case, blood pressure has to be monitored 3 times a day, at least for 15 days, to make sure that this lower dosage is very much good for you. This option can be discussed with your physician.
Okay. Just now, my cardiologist said it's okay if it is 110 by 60, so to continue the same medication. But I stopped taking on Sundays, just for, so that, because I thought it can go higher. But so I'm checking regularly, and it seems to keep normal
Yeah,
115 by.
don't completely stop taking the medication.
No, no,
You're
no.
supposed to be on a lower dosage of your
Okay.
current medication. You were taking telmisartan 40, right?
Yeah.
Yeah, so instead of telmisartan 40, you can be on half the dose, maybe telmisartan 20. But this again is not an advice from me. This is just a scenario that we
Okay.
usually practice with elderly patients. We put them on at least half the dosage. This is an option that you must discuss with your physician, especially if you feel symptoms like dizziness because of low blood pressure, or if you feel slight dizzy feeling when you're standing up or sitting down. Okay, this is something that you can only experience with your body. You know it the best. So you have to discuss it, put yourself on a lower dosage, and then you can see if that dosage works for you.
Yeah, okay. Just now I've just stopped taking on Sundays, but the BP is now quite okay.
Yeah, because it's been only one day.
No, no, every Sunday I don't take.
Okay, every Sunday you don't take as a, as a regimen.
Yeah, I have started myself. I have not yet consulted cardiologist on this. So I thought it was okay.
Usually it doesn't matter if you don't take every Sunday and you're taking the remaining 6 days. Okay, like I've explained to another colleague of yours, that is not how a medication works. It works with a 12-hour regimen. So that's why you are taking a medication every day to maintain the therapeutic dosage within your bloodstream. So if you're skipping just one day, but you're taking the remaining 6 days, you're still effectively taking that dosage, right? So what I would recommend you is just once visit your cardiologist, and talk about the option of reducing your dosage and trying it out for at least 15 to 20 days. If it works out, it's good for you. If it doesn't, you can still come back to your old dosage.
Okay.
Yes.
Thank you, doctor.
Yes.
Doctor, you're talking about some training.
BLS training, yeah.
Where can you get it, or
Yes.
how does one go about doing it? Or How's
Yes,
it done?
BLS training can be given by any BLS trained certifier, usually a medical practitioner. And if you want to get yourself BLS trained, you can always go into American Heart Association website. There is a sub website for India as well, and you can get yourself registered. There are many locations that provide BLS training in major cities of India. So if you're from Hyderabad, Bangalore, Delhi, Mumbai, major metropolitan cities, they have many centers. You pay a fee and they will explain you how to tackle a situation, how to tackle situations like stroke or cardiac arrest, or if a person is choking, how to give the proper CPR, mouth-to-mouth breathing, etc. It's very much important if you can get a gist of this training, and also advise your younger individuals of your families to get the same.
Doctor,
Doctor,
what is the
Yes.
full form? You said B for Bombay or V for Violet? VLS or BLS?
BLS, B for Bombay, Basic
Bombay,
Life Support.
Basic life support.
Yes.
Okay, thank you. Doctor.
Yes.
okay, doctor,
Yes.
I am ML Gupta, age 84.
Hmm.
I have been taking diabetic medicines for last many years.
Hmm.
And now I read that there is some new medicine which has come, Monjaro, which is injectable once in a week.
Hmm.
What is your opinion from traditional medicine of metamorphin and normal injections of compared to that, whether I should change to this medication?
Okay, currently are you using any insulin?
I am using insulin also,
Okay, insulin along with metformin.
metformin and other medicines, yeah.
Okay, so this is a newer drug actually. It is preferably, given your age, it's not preferable to start. If you were maybe 60 years, 50 years, it is much easier to start, because if there are any side effects, your body can still tolerate. But right now, your body is accustomed to a current regimen, and removing that regimen completely and inculcating a new drug within your daily regimen can be quite difficult for you as well. But anyways, if you want to consider this option, I'd recommend you to go to your diabetologist, because some parameters have to be taken into account when you are implementing a new drug, to check for any side effects.
Yeah.
Yes.
This medicine is supposed to be used for weight loss also.
Okay.
I don't know. This is very new medicine approved by American Association.
Yes.
So it's in lot of news and papers. So I thought I'll
Hmm.
just check up with you.
Yeah, I can understand, but I would prefer you to stick to your current regimen if it is working well for you, with not much side effects and everything.
Okay. Thank you, doctor.
Yes.
Thank you, Dr. Sadai, for a wonderful session. If any of the alumni is having any kind of query related to heart, you may ask. The main reason for organizing this session, because we have somehow analysis last 3-year claims data, and we identify the cardiovascular related claims has been a little higher. Hence, we have organized this kind of session. And this is just a beginning. In the upcoming days, we are going to organize many more sessions related to other activity, or any of the alumni is having any kind of particular requirement related any kind of activity, you may let us know in the group. And I really appreciate Mr. Suresh Chandwani for interactive for interacting doctor and to give more insight related to cardiac. And if any of the member is not part of the WhatsApp group, I would request it to join that group, so you can get update related to any upcoming activity, update related to the policy, and many more. So if any of the member is having any kind of query, any kind of concern, you may let us know to Dr. Santadeep. She will be help you out for understanding the points, or we are good to conclude. Thank you, everyone.
Thank you, doctor.
Thank you, everyone.
Thank
You're
you,
welcome.
Mr. Sahu. Thank you.
Thank you.
Thanks, everyone, for joining the session.
Thank you for your efforts. Yeah. Thank you.